So the braces I use are different than a lot of my colleagues, and it's an important difference, so I want to take a minute to tell you about that. The braces that probably 85% of all my colleagues use look like the brackets and braces that you see in the models here. If you look closely, you'll notice that there's little rubber ties that tie the wire into the bracket slots, and you'll see here there's some pink ties in every bracket. The kids like the color ties because every time they came in they could pick different colors. But about 10 years ago I stopped using this color tie method in favor of a more modern appliance known as the Damon System that looks like this. And if you look closely, you'll notice there's no more rubber ties. Every bracket just has a door that opens and closes, and that's how the wire is held in place. Well, why does that make a difference? So you can see it on a larger scale. The old way, with those rubber ties on every bracket, those rubber ties acted like little bungee cords. They grabbed onto that wire and held the wire in very tightly. Well, when we move teeth with braces, we move the teeth by sliding them along the arch wire. And with the rubber ties in place, they didn't slide so well. There was a lot of binding and friction on every bracket. So in order to get teeth to move, we had to overcome that binding and friction, which meant we had to pull with a lot of force. So the old way was a very high force method of moving teeth. The new way, which I've been using for about 10 years, like we said, there's no more rubber ties. Every bracket just has a door that opens and closes. So the door opens up. The wire goes in, the door closes, but without those rubber ties on there, there's hardly any friction. Teeth slide very easily. So if we don't have to overcome friction, we can lower our treatment forces. And with the new high-tech alloy wires that we use, we can lower the forces 400 to 600 times less than what we used to use. It's a very light force technique. So why is that important? Well, light forces are obviously more comfortable. The teeth don't hurt as much. Light forces are healthier for the roots of your teeth and the bone that surrounds the roots. And light forces also move teeth a little faster. So instead of the old 2 to 3 year treatment time, we can now treat most of our cases in about 14 to 18 months. So there are a lot of advantages to this light force technology. The biggest advantage, though, I think, is the ability of light force to move the surrounding bone with the tooth movement. So in other words, your teeth fit into a ridge of bone. And that ridge of bone is kind of shaped like a horseshoe. So for the first time with light forces, we can actually move that horseshoe of bone with our tooth movement. So we can widen the bone. If we can move the bone and widen it, we can fit teeth in ways that we never could before, so we're not pulling as many teeth. And also if we can widen the bone with this new light force technology, we're not using as many devices like palatal expanders, which actually split the suture and widen the upper jaw. So it's a lighter, kinder, and gentler way to move teeth. I want to take a second to tell you and show you actually some slides that will demonstrate on some clinical cases what we can actually do with this technology.